Hi, everybody. This is Mayor Pete. I'm here with our health director, Lisa Morrissey. Lisa,
hello.
Thank you for joining me. We were going to have Dr. Levin tonight, but Dr. Levin had to jump on another call, I'm sure, with everything that is going on nationally, here nationally with COVID and the state and the locality. So we're hoping Dr. Levin can join us Monday night at our town council meeting, of which he graciously gives us a national perspective and an update. And the reason why we're doing this special town hall meeting, and Mike, thank you very much for doing this for us, is to kind of give our community an update as far as what we're seeing as far as COVID. So Lisa, if we could talk a little bit first and foremost, some of the questions that I hear is, why are we concerned about COVID and this variant? Is there a difference? Is it almost a different type of disease? Why should we be concerned about this new Delta variant?
So first and foremost, it's the same disease, it's just with a little bit of a different spin. And most concerning about the Delta variant is that it is far more contagious than previous variants that we've seen. It's more contagious than the flu, it's more contagious than SARS and MERS and some of the other viruses that we have seen. So it's been on par with chickenpox, which those of you who are of the age to remember chickenpox hops from person to person pretty easily.
Right. Also, from what I understand, it attacks more of your lung capacity?
Correct. So we've been seeing increased hospitalizations across the country, which I'm sure everybody's been seeing on the news. And here in Connecticut, we've seen a tremendous uptick on the number of hospital beds that are being utilized by people who have COVID-19.
And that tends to, as of right now, when we look at, you see numbers, we both see the numbers every day. And when we see those numbers, right now, it's tending to be in the more densely populated areas where we're really seeing this big uptick in COVID numbers that we've seen in the state.
Yeah, so our urban cores have seen the sharpest increase in cases, literally going from 0 to 5 cases a week. Now some of them are in the 200s of cases per week. And then in areas like ours, as we were talking about, we're starting to see upticks in towns such as Brookfield, New Milford, and the areas. Not as sharp as what we're seeing in the urban cores, but it is quickly becoming a problem across the state and not just in our urban cores.
And for us, as we're looking at New Milford and how we look at managing our protocols, it's something that we need to be worried about as we're now in a yellow pattern versus some of the more urban settings, say Hartford, which is now in red, so to speak. So it's something for us to be very watchful of as we look at what's going on throughout the state, throughout the country.
Absolutely. And so Dr. Levin and I had a chance to talk a couple of times over the last week. And, really, it's hard pill to swallow, especially since we made such strides and we got very accustomed to not having those masks on. But keeping masks on are what will help keep us from going red. So that is one of the pieces that he and I have been talking about and really encouraging people to wear a mask when you're in indoor public settings. And
I know the CDC has recommended, so it's a recommendation to when you're inside to wear a mask, and that's really to protect those that have not been vaccinated yet, because you know more about it than I do, but from what I gathered you've been talking to me about, Dr. Levin, is even though I've been vaccinated, I still could get this COVID variant, so to speak, and it kind of sits on you, and then you could also give that to someone that is unvaccinated, which then would drive up hospitalizations further on because of the speed and the contagion of this new Delta variant.
Absolutely. So, and one of the things that we have been seeing local, and matter of fact, I actually was just talking to a couple of my counterparts in the surrounding towns, we've been seeing more cases of people who have been vaccinated that are COVID-19 positive, and they feel fine. They feel relatively good, or they have a mild illness, but unfortunately, their unvaccinated family members did test positive, and they're not feeling as healthy and well, particularly the kids who are under 12 years of age that have not been vaccinated, and in some cases, looking at our senior population over 65, have been contracted COVID-19 from a positive family member.
And Lisa, one of the things that your team has done such a tremendous job in, as well as the support of New Vance Hospital, that's partnered with us, and our army of volunteers where we still have our vaccination clinic. So if someone that wants to get vaccinated, can they still get vaccinated in the New Milford vaccination clinic?
Absolutely. So we have been out there every week. We never stopped vaccinating. So every Wednesday you can come and find us. We're at John Pettibone Community Center. We're there from 4 o'clock to 5:30. We have the Johnson & Johnson vaccine. We have Pfizer vaccine, and we just ordered more Moderna. So we'll have Moderna back for folks. So whatever the vaccine is that you're looking for, we will have it at the clinic. And, it really is encouraging. So we started to see our numbers drop off. And then this week alone, we doubled the number of people that we were seeing from last week. So I think people really are taking to heart the message that getting vaccinated is really one of the best tools that we have in our tool belt to protect ourselves.
And I know in the data that we see as far as vaccinations in New Milford, our first doses were at 18,342. That's kind of a 7 to 10 day look back, so to speak, which is 68.43%, and then fully vaccinated is 17,183, which is at 64.1%. And I think that's been very, very helpful for our community when it comes to really seeing these different variants.
Absolutely. So again, I say congratulations to the town. I think folks have really made it a priority to come out and get vaccinated. And it is my hope and my belief that because we're seeing such high numbers of vaccination in New Milford, it will afford us an additional degree of protection that some communities that have lower vaccination rates will not be afforded.
And Mike, I know Mike's back there helping us out tonight. Mike, do we have any questions? If you do have a question, please feel free to put in the comment bar, and Mike can let us know what comments or questions that we do have. We'd love to hear from you and answer any questions. That's kind of why we did this town hall with all the kind of the fast-paced moving parts that have happened with the CDC, putting out this recommendation. And then a little while ago, Governor Lamont put out a new executive order, which is going to really differentiate each community and how they handle COVID response, from whether they be an urban city to a more rural area like New Milford, or an even more rural area when you go up into the northwest corridor.
Right.
Okay, so we do have one question. Before we do, just a little bit of, since I'm the technical administrator here, just a little bit of technical stuff. We are recording this video, so it will be uploaded to the town's YouTube channel, and that way you don't have to go looking for Taylor Media. It'll be uploaded onto the town's YouTube channel as soon as I can. We'll get some audio cleaned up, and we'll get some timestamps put in there. We'll get the ends and trimmed off so you can improve your viewing experience. Last thing too, because of the sensitive nature of this topic, if we lose this stream because of the questions that get asked, that's just outside of our control, and we apologize. So the first question is from Cagney, and I'm not sure what specifically this was referring to. This question was asked when Lisa was speaking. Can we see the studies on this? I'm not sure what this is.
Sure. So I'm assuming that they're looking for more information on the Delta variant. There are lots of studies that are being published on the CDC, particularly the MMWR, which is where they really publish the weekly reports on Delta variant as well as the other infectious diseases that we are seeing. So we can probably post some links to that directly off of our page. Yeah, if people wanted to see some more of that. And I know Dr. Levin as well, he has several studies that he has shared with us in the past, and we can tap into his resources and put those up on the town page for folks that are looking for more information about that.
Excellent. And I know some of the data that we look at, Lisa, and which was concerning, right? So you're looking at the latest 2-week look back as far as cases for New Milford. So that was from 7/18 to 7/31.
Right.
It was concerning, even though they're small numbers, right? So we were doing great in the first week, which is you had 6 cases for the entire week.
And
so that's awesome. Though we don't want any cases. I mean, 6 cases is great. But then in week 2, we went up to 19 cases.
That's right.
So that's when you see the multiplier effect. You begin to say, okay, well, this is a little bit concerning. What do we need to kind of look at, and how do we help?
Right. And as you and I have discussed, and I don't know if our viewers at home are aware of this, that doesn't include tests. So when people go and pick up an over-the-counter test at CVS, Walgreens, Walmart, and you test at home, it does not include those figures. So those really are just the folks that are going out to a healthcare provider or a retail pharmacy and having them tested. So it is an incomplete picture. So when you factor that in, there are a lot of cases out there of COVID-19.
Now, the good news is, as far as the data that we see, hospitalizations for our county is still relatively low, very low, which is great news so far. I mean, we did go up another one, but we're at 2 for the entire county. But when you see the trends in the other areas, the more urban areas, it's still something that we have to plan for to make sure that our community stays safe. Do we have any other questions so far, Mike?
We have quite a few, Pete.
Okay.
So Terry asks, will mandates
Hi,
be
Terry.
Will any mandates be in place in New Milford?
So right now, Terry, we're reviewing this on a daily basis. Right now, we are in the yellow category, and we're continuing to monitor it. We're following the recommendations of the CDC, which they recommend that if you go into an indoor atmosphere, to wear a mask. I know if someone has diabetes or a pulmonary condition, especially if you're going into a high volume store, it'd be highly recommended that you go in and you just do the safe thing and wear a mask. But as of a total mandate right now, we're watching this on a daily basis, and we're following right now the CDC recommendation, which is recommending that you wear a mask when you're going indoors. Outdoors, no masks are required. Get a lot of exercise and energy, get some sun, and go visit our beautiful trails and river walk that we have, and enjoy the summer atmosphere so far. And Lendemi Beach.
Okay, Pat asks, if boosters are required, will we have to wait until unvaccinated get vaccinated?
That's a fantastic question. So as soon as the FDA approves the boosters, you can go ahead and schedule a booster, assuming that the state of Connecticut does not put any limitations or triage as to who can get the vaccinations. At this time, we haven't heard any indications that that will be the case, and our plan is to offer the booster as soon as we're able to do so.
And the great news we saw, I mean, we've been asking and talking about this for months now, is Moderna actually has stated that you need a booster.
Right.
Okay, so please do remember that caveat I gave at the beginning. Some of these questions are going to get kind of tough questions, guys. So
Absolutely.
all right, we'll field them. Richie asks, where did the flu go? I believe he's referring to the common flu.
Okay, Richie, great question.
That is a fantastic question. So just like how our masks help prevent COVID-19, what we found last year was that because so many people were masked and we had people that really were avoiding a lot of large gatherings because we couldn't do any of them, we found that influenza and a lot of our respiratory viruses, the transmission fell all the way down. So we saw upwards of a 97% reduction in influenza. However, since in 2021, since masks went away in April and May for many states, what we saw was an explosion again of respiratory viruses, and we saw a comeback of influenza this year, and we're actually expecting that we're going to see that trend continue. We're having an early respiratory virus season this year, so it's back.
And in planning, we talked about this, and you had said that, you know, with the unmasking, we probably would have more of these viral, whether it be flu or other pulmonary issues, rearing their ugly head again. But I know within our vaccine clinic, you're going to be offering the flu vaccine for people.
Very excited about that. So as our mayor said, we anticipated that. We knew it was going to happen, and we didn't want to wait for it to be on top of us. So we did apply for them. We were approved to do flu vaccines. So we'll be having high-dose flu vaccines for seniors as well as regular quadrivalent. And for folks that have egg allergies, we'll also have egg-free flu vaccines available. So we're anticipating that we're going to start the second week of September, and we'll have a schedule up on the website where you can sign up for appointments.
And Lisa, that leads to another thing too that you've been a big proponent of, and that's COVID testing and the availability for those that free COVID testing for our community. And I believe you're starting that back up now in Wednesday of next week.
That's right. So Wednesday of next week, New Milford Health Department will begin COVID-19 testing at John Pettibone Community Center, the same place where we do our vaccines. So in the mornings from 8 until 9:30, we'll be out there doing COVID-19 testing. It will be by appointment only. There will be a link up on the website where you can go ahead and schedule an appointment if you need to get tested for COVID-19. And then again, a gentle reminder, I know you guys are tired of hearing me say this, this, but COVID-19 is a sneaky one. Some people say that they just feel tired, they just have a headache. I can't tell you the number of times that people told me that they thought it was just their allergy. So if you have any symptoms whatsoever of COVID-19, I do encourage you to go and get tested.
And kind of segue with that too is if you are not feeling well, please get tested. But also, don't go to work.
Right.
And if your child is exhibiting any symptoms once we get back into school, please do not send them to school.
Absolutely.
Get tested. Talk to your primary doctor. And if we do these smart things we talked about before, especially hand hygiene, which we've talked about putting it 20 seconds under the hottest water you can tolerate, soap up to your wrists, under your nails, or if you don't have that, hand sanitizer. Just doing that makes a big difference.
Yep.
Any other questions so far?
Yeah, so I'm going to skip ahead just a tiny bit because there's an administrative question here for tonight's stream. Irene asks, let me see, where was it? Mike, you skipped my question. What gives? Just so folks know, the user interface that I have is the broadcast side of things. So I'm just reading the questions as they come up chronologically for me. They might be a little bit different for you guys at home. So just so you guys know. All right. So I don't know who this is, but Unmask is the user's name. There are no tests that decipher the Delta. Please tell us how we know these cases are Delta. Has there been a new test implemented?
Great question. So you can't walk into a testing site and say that I want to test for the Delta. What they actually do is that they randomly sample the tests that are coming in to look to see what the variant is, and that they do a trace back. But you are correct. You can't just walk into a site and say that I'm looking for the Delta test.
Okay. Ray asks, if you guys are vaccinated, why are you wearing masks?
Because we are role modeling, we're role modeling the behavior. So we're in an indoor setting and we're sitting less than 6 feet apart. So we are doing the practice what you preach. I know that Pete and I both feel the same way on this. We would never ask people to do something that we ourselves were not willing to do.
So the fact that we're not 6 feet apart from one another.
That's right.
And we are indoors. We are wearing the mask, which is what the CDC recommends that we do.
Okay, so real quick, Pete, an administrative question to you from me. So I see some of these questions are replies to other people. They look like they're targeted for us to ask, for the panel to ask. Do you want me to forward those questions, or do you want to try to use my judgment as to who they're asking questions?
You can use your judgment, Mike, or whatever, however. We'd like to answer any question anybody has.
And if we can't get to all of them,
Yep.
I'm sure that we could, if you have a
Absolutely.
recording of them, we're happy to answer them and stick them on the website.
Okay, well, there's a lot, just so you know.
That's fine.
The user Unmask has a second question. It looks like a follow-up to the flu question. The CDC has said that influenza positives are included in the PCR tests. Therefore, okay, excuse me, I have to correct some grammar here. Therefore, these can very well be influenza, correct? Okay, therefore, these can very well be influenza, correct?
So I'm assuming what this user is talking about is the BioFire respiratory panel testing. There is a combined test where you can test for multiple respiratory viruses, including influenza, adenoviruses, coronaviruses, including SARS-CoV-2, otherwise known as COVID-19, all in one. So if it's a combination test that is included, but that doesn't necessarily mean that someone who is, what am I trying to say? Influenza is included as a positive COVID-19. They would have to be COVID-19 positive in that combined test to be counted as that positive.
All right, Terry asks, when will we know the plan for school openings?
Great question.
You know
Lisa?
what? We're both
We were just
laughing.
talking about this.
We were laughing because we were having this conversation because the state of Connecticut really sets the tone for what happens this year with the schools. And as of right now, they still have not released that updated guidance as to what parents and what we can expect in schools. And I know that when we talk to Superintendent DeCorpo, it really is something that, you know, we're all struggling and waiting for that guidance. And as soon as we have that, we'll be pushing that out to parents so that they can start to prepare.
I think all the districts are waiting for the same thing, and that's
We are. Yep.
the state to give guidance to the districts.
Okay, Irene has a series of questions. It looks like they're broken into 3 topics, so I'll break those topics up so you guys aren't just bombarded with questions all at once. Okay. So it sounds like Governor Lamont is going to leave the decision to mask children to the individual towns. What is going to happen in New Milford since children cannot be vaccinated? Follow up: Will you keep them and educators and staff safe?
So great question. Right now, as we just said before, the guidance so far has been that the state, through the State Department of Education, decides how the schools are going to treat COVID. Until we get additional guidance, whether it be to the municipality or to the Board of Education or the state itself, we're kind of right now in a no man's land, so to speak, until we get that guidance from the State Department of Education.
Absolutely.
Okay, part 2 from Irene. Will meetings in town hall, go back to virtual? It seems to be the prudent thing to do with this new variant.
So currently we are going to our next town council meeting here on Monday night. We'll be in town hall. We will be, because we will be less than 6 feet apart, we will be wearing masks, asking those individuals that will be here for public comment to be in masks. We do have, as we're here tonight, we have the ventilation here, and we're going to continue on with doing meetings in person.
All right, this is a follow-up question to that from me, since
Yep.
I'm going to be there. Do participants in the audience, will they be required to wear a mask?
Yes.
Okay. Okay, so if there are any town councilmen that are going to be watching this, or any, if Greg or if our attorneys are watching this, if you guys are going to be wearing masks, just if you guys could please speak up when you get to the microphone. It's Monday night. I'd really appreciate it. Having those masks muffles things.
Yes.
We're already competing with the fans and the ventilation. So, all right. So her third question is: any way to get N95? This is Irene again. Any way to get N95 masks available to townspeople? It's really the best mask as opposed to a gaiter or a cloth mask.
So, Irene, you can purchase an N95 mask. You can go online and get an N95 mask if you so choose. I believe some of our, some of our merchants were selling those, so you can pick those up. And I believe they come in groups of 10, or you can buy one, whatever's most convenient for you.
And just a quick reminder, Irene, if you are using an N95, you do need to be fit tested for those. And
Yep.
because that they do have more resistance, it is always recommended that you talk to your healthcare professional before using an N95 mask.
Thank you, Lisa.
Oh. All right. So Lynn asks, how far out from second shot will we need a booster?
Fantastic question. So I'm going to be in uncharted territory here, and I'm going to give you what we know from the scientific evidence and not necessarily what we know from the FDA. So we really are waiting for the FDA to make that determination. They're the group that actually makes the recommendation to the CDC and the ACIP down to us vaccinators as far as what that spacing will look like. What we do know is that immunity starts to decline after 6 to 8 months. So it's conceivable that folks that were vaccinated in late 2020 and early 2021 are going to be the first ones that are going to be ready for that vaccine. But again, as far as the exact timing as the spacing between shot 2 and shot 3, we really will have to wait until after the FDA puts that recommendation out.
And one of the things I know we've both been big proponents of is for those that have been vaccinated and getting their booster is to really get, as you said, the FDA and getting them to give the green light so that we're able to get these boosters.
That's right.
So any help in creating that awareness and really calling your state senator or federal senator, Senator Blumenthal, Senator Murphy, letting them know that you're as concerned as we are about us getting boosters for those that have been vaccinated. Any help to create additional efficacy in this fight against COVID is something I think it's well worthwhile. Then we're hoping that, as you said before, we can get these booster shots into the arms of those that have been vaccinated already.
All right. So, real quick for everybody, since we have a ton of questions to get through, if you guys want to engage with each other, that's great. I'm not reading comments. Make sure you guys have questions for the panel to answer, just because we have a lot to get through. So, Melanie asks, can we get an antibody test to see if we need a booster?
Absolutely. So antibody tests are widely available. You can actually go to your primary care physician and they can do an order for one. If you don't have a primary care physician, you can use one of the federally qualified health centers. And if you don't have access to a federally qualified health center, I do know that the Red Cross, when you donate blood, they automatically do an antibody test for you when you give blood. So that's a really great way to give back to the community and get an antibody test.
Okay, Tracy wants to know if you guys can answer questions about this public schools, because her question is, I'm curious if the kids can change classrooms in the middle school or if they will need to be contained again.
So-
Go ahead.
I was going to say, so that probably is a question that's best left to Superintendent DeCorpo. I know that they have been working really hard over the summer to come up with a strategic plan to keep our kids safe and to try to really give them as much normalcy as possible. But that would be outside the scope of something that I'm able to answer.
Absolutely. And I know as soon as she gets the guidance, I know she'll be putting out all that information for our parents and our students as we get closer to the day of opening of school.
Right?
Okay, Rich asks, can a person show negative for COVID but be positive for Delta?
So since Delta is a variant of COVID, they would test positive for COVID, presuming that they're positive for the Delta variant. I think that's what you were asking me, right? Can you be negative COVID but positive for the variant?
I think that's what they're going for. I mean, my follow-up to that would be, so if you're taking a standard COVID test,
Yep.
and you had one or the other, you would test positive, correct?
So I'm going to try to clarify this so that we're all on the same page. You can go for the most common tests you're going to find are either an antigen test, which are commonly referred to as a rapid test, or the PCR test, which is a culture and we grow it, and that takes a little bit longer. You can get a positive on either one of those for COVID-19, and you can have the variant or not have the variant and be positive, right? We know that you have the variant because after you test positive, they do some additional analysis to determine which variant of COVID-19 that you have and if it's Delta or one of the other variants. So in order to be positive for Delta, you have to have COVID-19.
Right, because the alpha variant is just another variant of.
They're just variants. So
Yeah.
it's just kind of like saying,
So,
do I have
so it doesn't matter. It doesn't matter which one you have. If you take a standard test, if you have one or the other, you will test
Right,
positive,
so then-
and it would take further research to determine which one.
Which variant, correct. So, and I think what the confusion is that people think that they can walk into the store and say, like a Delta variant test, and that does not exist. So we're testing you for COVID-19, and then we're randomly picking tests out of all of the people who've tested positive to see what variants they've tested positive for.
Okay, Josie asks, hi Josie, I am going to a wedding outdoors, but will be under a pavilion with about 90 people. Masks or no masks? I think it's a recommendation, Court.
It's a recommendation, so it will really be up to the facility that's holding it and the bride and the groom, so it's a recommendation. And since it's outdoors, there are no masks that are required. And in that case, I can say congratulations to the bride and groom.
Absolutely.
Michael asks, in Connecticut, what percentage of positive COVID tests are sent for full genomic testing to determine the variant?
That's a really great question. Unfortunately, I do not know the answer to that off the top of my head, but I think that we might be able to look that up on ct.gov. So if that's something that you do have an interest in, I would direct you to look at the state's data website, and it's at ct.gov. And in the top banner, they have a link for the coronavirus data center. So if you click that, it actually has a link of all of the types of methodology that the state is using for the COVID-19 test, and they can explain that, because I think there are a few labs that the state are using to do the additional genomic sequencing.
All right, it actually looks like we've gotten through all of the questions. I don't know if you guys had any more topics you wanted to discuss quickly while we get more questions
I
piled
just
in.
think we just continue. The reason why, and Lisa, thank you for being here tonight, is just to create the awareness that, we are, compared to other towns, doing, I think, a very, very good job. Yeah. We are being watchful of, whether it be other parts of the state or parts of the country with upticks. We just want to keep you as informed as we possibly can, because at the end of the day, it's your choice. You're going to decide at the end of the day, do I want to get vaccinated? Do I not want to get vaccinated? What are all the safety measures? I mean, I have some people, Lisa, this kind of was leading me to the question of just saying, the FDA has not approved the vaccine in its entirety. They gave it emergency rights to do the vaccine, so I don't feel it's safe. So what, if someone was to say that to you, what would you say?
I would say that we have a preponderance of evidence that suggests that it's safe, that the side effects that we've seen have been minimal and in line with what we see with other vaccinations. And it's a safe vaccine. And speaking to that, it's expected that the full approval for the vaccine for both Pfizer and Moderna are weeks away, with Pfizer coming first with probably the end of this month or early September. And I do think that this speaks to the large body of evidence of the millions of people that have been vaccinated.
And that's really the really most efficient and best way to really tamp it down is for
Absolutely.
getting those that do have questions answered, and hopefully they feel a little more at ease when it comes to deciding to get vaccinated. And the more that we can, as you had said in the very beginning, the more of a insulary bubble we can create here in New Milford.
Absolutely. I couldn't have said it better. And since we're winding down the clock, I would also like to remind everyone to be kind and courteous and respectful of others for their decisions to wear a mask and not to wear a mask. I know that while we are strongly encouraging people to wear a mask, if people are electing to not wear a mask, that could be for their own personal reasons or because maybe they have a medical condition. And just be respectful of people's ability to make a decision, a choice for masking and for vaccinations.
Lisa, that is just such a great comment. And I know for quite some time, especially when we're going through this, a lot of people were, I was seeing it in the community, being respectful of people's choices. I know times like now, it gets, we're all tired. We're all tedious of this and kind of settling back a little bit, taking a step back. I know it can be, for some, where some people get angry or some people question a lot of things. We're all trying to make informed decisions for ourselves and for our family and our loved ones. As you said, if we can be respectful of that, make sure that you get all the information for yourself and for your family to make that proper decision. And I think as we continue on, as a town, we're going to be offering all of these opportunities, whether it be a vaccine, getting COVID testing, so that you can make these decisions, and giving informational town hall meetings like we are today, so that you have the ability to have, knowledge is power, to give you the ability to do so. Do we have any other questions, Mike?
Yeah, a few came in just a few moments ago. Technical question from Allie. I missed the live at 6 p.m. Where can I go to see it? The video right now is still rewindable, so if you'd like to rewind back to the beginning, you can. Once we stop the live stream, there'll be about 2 or 3 hours where you won't be able to do that, and then the video will go through processing on Facebook's backend. I am recording the video, so as soon as I get the chance, I'll upload this to the town's YouTube channel, and that's just Town of New Milford on YouTube. If you go into YouTube and search New Milford, Connecticut, it's the first channel that shows up. And if you could do us all a favor and subscribe, and so we can get to the 1,000 subscribers threshold so we can qualify for live captions, that would be helpful. Pat asks, is there any time suggested when the FDA approves the vaccine?
Is there any, I'm sorry, I missed that.
I'll read it literally, and then I'll translate it for you. Is there any time suggested when FDA approves the vaccine? So I think she's asking for, is
When
there
do we
an
think it's going to
expectation?
happen?
Yeah.
Yep, so it's expected that the full approval for Pfizer will happen at the end of August, early September is when we're anticipating that we'll get that, and Moderna will be shortly thereafter.
And she follows up, still hearing from the immune-compromised, they don't feel they can get it. Even people with asthma saying they can't get it. Can you give some advice on this?
And so immunocompromised people are some of the folks that we most recommend them to get vaccinated. So if they have a particular medical situation, they really do need to discuss that with their provider, why they feel that they can't get it. We find that it's very rare. There are very few people in that group that can't get the vaccine because of medical reasons, but they should absolutely discuss that with their medical provider. And if they do get the clearance, I will be happy to see them on Wednesday between 4 and 5:30 down to John Pettibone.
All right, that wraps it up, Pete.
Okay. Well, Lisa, first of all, I want to thank you for, again, your super busy time, taking some time out so we can answer our residents' questions, especially when it comes to COVID. Mike, thank you for getting this out to our public. And I want to thank you, the public, for tuning in tonight. Difficult conversations that we have to have, but I think you as a public need to know and get as much information as you can during this pandemic. We'll continue to be offering these throughout the pandemic when we need to be doing this. And I know, Lisa, you've been gracious to come on our regular virtual town hall meeting too, to keep us all informed. Again, I want to thank you guys for tuning in. Before I say it like I do on all of our town hall meetings, I cannot thank the public enough, our first responders, medical community, even though they're out of school right now, our teachers, administrators, all of our town hall employees, including our facilities team that does a phenomenal job. Also the Board of Ed, their facilities teams too, they're doing those deep cleanings. Everybody involved, our nonprofits, everybody working together to get our town through this pandemic. We can't thank you enough. God bless New Milford proud, New Milford strong. Talk to you again.
Thanks,
Thank you,
everyone.
everybody.